Dr. Chatterley, can you tell us a little bit about TMJ, which basically means that the jars here, the hinges of the jars, that's the only way I want to pronounce that word, TMJ, is basically misaligned, and it seems to be one of the most complicated hinges in the body. But either way, when that is misaligned, all kinds of stuff happens. And again, the stuff which happens seems to be things like headaches, shoulder pain, back pain, all coming from the mouth. Shed some light on it. Tell us what the cause there is and what is all involved.
Okay. For several years, in the about the mid-'80s, there was a lot of research and continuing education in the area of what they call TMJ, which stands for temporomandibular joint. Well, everybody actually has temporomandibular joint. The two jaw joints, that's the temporomandibular joint. So after a few years, after they'd got everybody into the habit of calling a misaligned problem TMJ, they got into the habit of calling it TMD, meaning temporomandibular dysfunction. Let me explain the dysfunction. The joint is the most complex joint in the body. All the other joints, like your elbow, you stretch your arm out, and the vagal nervous system that you're unaware of tells you by muscle extension when that joint is fully extended. And so it sends a message back to the brain and says, okay, don't stretch me anymore, we're fully extended. The only joint in the body that's determined by something other than muscle and is determined voluntarily instead of through the vagal nervous system is the temporomandibular joint, because it's the hard structure of the teeth coming together that determine the closure of the jaw and the use of the joint. Well, when the teeth might be misaligned, then the jaw that has both rotation and translation, it's like this: the condyle rotates and it also translates, has a disc in between it, and it's all sealed up in a synovial fluid. It has a capsulated joint. When the bite or the jaw, if there's, structurally, if the jaw grew out of alignment, if the bite is out of alignment, then the 5 sets of muscles that cradle the jaw and make the jaw work have to accommodate what the teeth are telling when the teeth hit together. So if they hit first on one side and then there's a slant and a slide, then those 5 sets of muscles have to get into a pattern that help it happen. Well, getting into that pattern, they become tense and tonic. Tonic means they're firing all the time. And if you touch one of those muscles, it's very sore because it's in a spasm, it's in a tonic state. And in correlation, those 5 sets of muscles, some of them very tiny, the internal pterygoid muscle is tiny, but it can get very sore and be very a painful part of the situation. But the other muscles of the head and neck and back are related to this positioning. So if the jaw's out of alignment, then other muscles like the sternoid, cledoid, mastoid here can get very, quote, hot. You can just press that, and it's, for somebody that has a temporomandibular dysfunction, that muscle can be very sore. Well, also the muscles in the back of the neck, the muscles coming up in the occipital area, and the temporalis muscle, the masseter muscle, those can get all very tense and tonic. And it can lead to shoulder pain, headaches, a lot of related problems, and the real source is the misalignment and the accommodation of the misalignment of the muscles to the joint, closing where the teeth tell them to hit, and how they hit.
How can we fix it? How can we fix it? Can we fix it?
Yes, it can be fixed. I'm a sitting testimony right in front of you of it can be fixed. I had TMJ problems develop I went through orthodontics at age 35. When you're younger, you're more resilient, and your body's able to adjust and accommodate more, it seems. As time goes by, that's not the case. You start to, as you and I both know, we start to seize up as the years and the decades go by. But at age 35, I had orthodontics. My teeth didn't look that terribly misaligned. It wasn't just for the looks, but it was really for the function of arranging that bite so that it harmonized. See, that's the best way to say it. You want the muscles to harmonize with the joint, and if you get the joint and the muscles harmonizing, then all those other related symptoms are not going to appear. But once somebody has been in that pattern for years, it's not just a dental situation. They also can be very much helped and overcome as they get things put back in order for the harmony. The chiropractor is extremely useful in relieving the head and neck symptoms. And also, believe it or not, the chiropractor may find that the feet are out of alignment and send the patient to the podiatrist, or vice versa. We may see that, their neck and back is bad, and their back's not, they're having lower back problems or having mid-back problems. We might send them to a podiatrist, and podiatrist might send them to the chiropractor then, vice versa. But it's all about alignment and harmonizing. And also, I have a friend that's a patient, and I've gone to him for acupuncture, and he has helped out several patients in the early stage when it's mostly just joint related. If it's a joint centered problem, the acupuncturist can in just a few appointments make a considerable difference for a patient. But putting everything into alignment and then getting the other support help, somebody sitting there thinking, oh, gee, I'm going to be sent to a bunch of doctors to get this resolved. Believe me, I know from experience, it is worth its weight in gold to take care of a TMJ problem and the associated head and neck headaches. I had headaches that lasted up to 4 days. They started out in my younger years. They were low-grade headaches. As time went by, I didn't realize how much time monthly I was spending in the mode of having a headache. It got worse as the years went by, and that's why I finally, went into the orthodontics and had my bite corrected. And then started going consistently to the chiropractor. In later time, I got to know Mike, the acupuncturist, and the Chinese medicine approach, which is very interesting, by the way. But had acupuncture, and all those modalities have helped so that I'm not living with a headache. It got to the point where it was a migraine, and the normal Advil or combination of Advil and Tylenol, and taking the two together, which is synergistic. It's not too much to take both of them at the same time, but they weren't even affecting the discomfort I was having. And so rather than try to solve a problem purely by prescription drugs, which unfortunately many people end up in that mode of treatment and end up somewhat addicted or very addicted to prescription drugs, if they pursue a route and think about the costliness of that in a person's life versus having it treated by those that are trained to put it back in alignment.
Right. Well, because also, for all purposes, if we look at it, if there is such a person or such a entity like God, He surely didn't make us born with a drug deficiency. with a medicine deficiency, except if you were unlucky enough to have a mom who was taking a bunch of drugs. But rather than that, we're just simply not drug deficient. And a natural body, it's much, much better than a Swiss watch, the way it works together. And what we don't realize is, look how many important parts there are in the head: the eye, the brain, the mouth, the nose, the ears. You have like all these and very fragile parts. So why would it be such a wonder that the teeth and the way they're aligned and the jaw also doesn't affect the rest of the body? We know that if a person has too many missing teeth, his bones will shrink. He will start looking like a dried out tomato, then tries to go to a plastic surgeon when all he would need to do is make sure he keeps his teeth, or at least puts implant in it when they're gone. And all those, all those type of stuff. And now the headache, yes, it works together, and people need to realize. Now, you said that you went to an orthodontist, and you yourself are a dentist. Now, does it always need an orthodontist, or is it most of the time the dentist who can do that, and just in some cases an orthodontist is also needed? Tell us in very short, we don't have much time anymore, but tell us in very short ways.
Oh, that's exactly right. Sometimes it's just a matter, believe it or not, if there might be one molar tooth that has what we call a prematurity, and the muscles get used to accommodating the bite for that prematurity. It's an area of the tooth that hits first, and then all the muscles have to go to work to accommodate the bite. Well, those muscles tense up, and they get all these symptoms, and it may be as simple as an adjustment on one tooth will make a big difference. Or they may go into an appliance to deprogram their muscles. An appliance meaning like a orthodontic retainer, but it has acrylic on the top, so their teeth get used to they're freed up from the pattern that their teeth set for them, and then the dentist can do an occlusal adjustment. There might be several areas around the bite with prematurities, so they adjust those prematurities out. In my case, it required orthodontics. That ends up being a more advanced case, that they have to align the teeth that way. Very often, the alignment and the correction, the harmony, can be achieved with a lesser involved treatment. But deharmonize or deprogramming the muscles and then finding the prematurities, bite adjustment is often what is necessary all that is necessary, and then they're up and running again gradually phase out the appliance.
So a person who has had headaches, muscle pains, back pains maybe even, and all kinds of stuff, and kind of did do a few things, tried a little chiropractor, tried all kinds of little other things, and it just doesn't seem to go away. It would be a good thing for him to go to a dentist and check out his bite and his TMJ, problem. One way or the other way. It may not be it may still be something else, which then the person needs to continue to look for, but it just simply might be it. And then, in coordination with chiropractic, acupuncture, maybe a podiatrist, and maybe it's not needed, but depends on what it is, because once a muscle is very tense for a long, long time, most likely it threw out some of the bones in the vertebrae. And also, either way, whatever it takes, he might have overlooked the fact that he might just have one molar which sticks out a little too much and throws the whole body out of alignment, literally.
Yeah, that's exactly the case. There's a terminology used in dentistry called a balancing side interference. And it's a certain side of a tooth, and it can cause all kinds of symptoms, and just, it's amazing. Just one simple adjustment, and that person is so much comfortable almost instantly. But, that's not the case with everybody, but
sure.
When we examine a temporomandibular joint problem or dysfunction, hey, if it's not broken, we don't need to fix it, but
right.
If it's something else. But if it's contributing or the source, then we can start directing how it can be taken care of.